Norepinephrine and epinephrine are two hormones that play crucial roles in the cardiovascular system. Understanding these hormones is essential for healthcare professionals involved in the management of cardiovascular conditions. Norepinephrine, also known as noradrenaline, is released by the sympathetic nervous system in response to stress or low blood pressure. Its primary function is to maintain blood pressure and heart rate. When norepinephrine is released, it constricts blood vessels, increasing blood flow to vital organs such as the brain and heart. Epinephrine, on the other hand, is commonly known as adrenaline and is responsible for the fight or flight response. It is released in stressful situations and helps the body prepare for physical exertion. Epinephrine acts as a vasodilator, relaxing the smooth muscles in blood vessels and increasing blood flow to muscles and the brain. Additionally, it stimulates the heart, increasing heart rate and cardiac output. Understanding the roles and differences between norepinephrine and epinephrine is crucial in the management of cardiovascular health and the treatment of related conditions. Now, let's delve deeper into their specific applications within the cardiovascular system. Roles of norepinephrine and epinephrine in the cardiovascular system. Both norepinephrine and epinephrine play critical roles in maintaining cardiovascular health. Norepinephrine is primarily involved in regulating blood pressure and heart rate. When blood pressure drops or the body perceives stress, norepinephrine is released to constrict blood vessels, redirecting blood flow to vital organs and increasing blood pressure. This response helps ensure that essential organs receive adequate oxygen and nutrients. Epinephrine, on the other hand, is responsible for the fight or flight response. When faced with a stressful or dangerous situation, epinephrine is released, causing blood vessels in non-essential areas, such as the skin and digestive system, to constrict. In contrast, blood vessels in muscles and the brain dilate, increasing blood flow to these areas. This redirection of blood flow helps prepare the body for physical exertion, enabling it to respond effectively to the perceived threat. Additionally, epinephrine stimulates the heart, increasing heart rate and cardiac output. This response ensures that the muscles receive sufficient oxygen and nutrients during times of stress or physical activity. The combined effects of vasodilation and increased heart rate make epinephrine a vital hormone in emergency situations. Similarities and differences between norepinephrine and epinephrine. While both norepinephrine and epinephrine are involved in the body's response to stress and play important roles in the cardiovascular system, there are some distinct differences between the two hormones. One key difference lies in their vasoactive properties. Norepinephrine primarily acts as a vasoconstrictor, narrowing blood vessels and increasing blood pressure. In contrast, epinephrine acts as a vasodilator, relaxing smooth muscles in blood vessels and increasing blood flow to muscles in the brain. Another difference lies in their specific actions on the heart. Norepinephrine primarily increases heart rate and cardiac output through its vasoconstrictive effects, which indirectly stimulate the heart. Epinephrine, on the other hand, directly stimulates the heart, increasing heart rate and cardiac output. Furthermore, norepinephrine has a more localized effect, primarily acting on alpha receptors, whereas epinephrine acts on both alpha and beta receptors. This difference in receptor specificity leads to variations in their overall effects on the cardiovascular system. Understanding these similarities and differences is crucial for healthcare professionals when deciding which hormone to use in specific cardiovascular conditions or emergency situations. Norepinephrine and epinephrine in the treatment of cardiovascular conditions. Norepinephrine and epinephrine are commonly used in the treatment of various cardiovascular conditions. Their distinct actions on blood vessels and the heart make them valuable tools in managing these conditions effectively. Norepinephrine is frequently used in cases of hypotension, where blood pressure drops significantly. By constricting blood vessels, norepinephrine increases blood pressure and restores circulation to vital organs. It is often administered in emergency departments and intensive care units to stabilize patients in critical condition. Epinephrine, on the other hand, is commonly used in cardiac arrest and anaphylaxis. In cardiac arrest, epinephrine is administered to stimulate the heart and increase blood flow to vital organs. In anaphylaxis, epinephrine helps reverse severe allergic reactions by constricting blood vessels and relaxing airway muscles, thereby improving breathing and blood pressure. Understanding the specific applications of norepinephrine and epinephrine in different cardiovascular conditions allows healthcare professionals to provide targeted and effective treatments to patients in need. Common applications of norepinephrine in cardiovascular health. Norepinephrine finds its primary application in the management of hypotension, a condition characterized by low blood pressure. When blood pressure drops, Norepinephrine is administered to constrict blood vessels, increasing blood pressure and restoring circulation to vital organs. Hypotension can occur for various reasons, such as sepsis, hemorrhage, or certain medications. In emergency situations, norepinephrine is often the first-line treatment to stabilize patients with dangerously low blood pressure. Its vasoconstrictive properties help restore blood flow to vital organs, ensuring they receive the oxygen and nutrients required for optimal function. Norepinephrine is commonly administered through intravenous infusion, allowing healthcare professionals to titrate the dose according to the patient's response. It is crucial to monitor blood pressure closely during norepinephrine administration to ensure that the desired effect is achieved without compromising other aspects of cardiovascular health. While norepinephrine is effective in increasing blood pressure, it is important to consider potential side effects and precautions associated with its use. Let's explore these aspects further. Common applications of epinephrine in cardiovascular health. Epinephrine is widely used in emergency situations and plays a vital role in the management of cardiac arrest and anaphylaxis. In cardiac arrest, when the heart suddenly stops beating, prompt administration of epinephrine is crucial. Epinephrine stimulates the heart, increasing heart rate and cardiac output, thereby improving blood flow to vital organs. It is often administered as part of cardiopulmonary resuscitation (CPR) protocols to increase the chances of successful resuscitation. In cases of anaphylaxis, a severe allergic reaction that can be life-threatening, epinephrine is administered to reverse the reaction. Epinephrine acts quickly to constrict blood vessels, relax airway muscles, and reduce swelling, effectively improving breathing and blood pressure. It is typically administered through an auto-injector device, allowing individuals experiencing anaphylaxis to quickly self-administer the life-saving medication. Epinephrine's rapid and potent effects in emergency situations make it an essential tool for healthcare professionals and individuals at risk of severe allergic reactions. However, it is important to be aware of its potential side effects and precautions, as we will discuss further. Side effects and precautions of norepinephrine and epinephrine. While norepinephrine and epinephrine are valuable tools in cardiovascular health, they are not without potential side effects and precautions. Norepinephrine, being a potent vasoconstrictor, can lead to tissue ischemia if administered at high doses or for prolonged periods. It is important to monitor peripheral perfusion and assess for signs of tissue damage, such as cool extremities or diminished pulses. Additionally, norepinephrine can increase heart rate and cardiac workload, requiring careful monitoring in patients with pre-existing cardiovascular conditions. Epinephrine, on the other hand, can cause side effects such as increased heart rate, palpitations, and anxiety. These effects are often transient and resolve once the medication wears off. However, in individuals with underlying heart conditions, these effects may be more pronounced and require close monitoring. Both norepinephrine and epinephrine should be used with caution in patients with certain medical conditions, such as hypertension, hyperthyroidism, or pheochromocytoma. In these cases, alternative treatment options or adjusted dosages may be necessary to minimize potential risks. Understanding the side effects and precautions associated with norepinephrine and epinephrine helps healthcare professionals make informed decisions when selecting the appropriate treatment for their patients. Choosing between norepinephrine and epinephrine for cardiovascular treatment. When it comes to choosing between norepinephrine and epinephrine for cardiovascular treatment, healthcare professionals consider various factors, including the specific condition, patient characteristics, and desired therapeutic effects. For patients with hypotension and low blood pressure, norepinephrine is often the preferred choice due to its potent vasoconstrictive properties. It helps restore blood pressure and ensures adequate perfusion to vital organs. Norepinephrine is commonly used in intensive care units and emergency departments for patients in critical condition. On the other hand, in emergency situations such as cardiac arrest or anaphylaxis, epinephrine is the go-to medication. Its ability to stimulate the heart, increase heart rate, and improve blood flow to vital organs makes it invaluable in these scenarios. Epinephrine is often administered by healthcare professionals or self-administered through auto-injector devices in the case of anaphylaxis. The choice between norepinephrine and epinephrine ultimately depends on the specific clinical situation and the desired therapeutic effects. Healthcare professionals consider the patient's condition, response to previous treatments, and potential risks and benefits associated with each medication. Future developments in the use of norepinephrine and epinephrine in cardiovascular health. As our understanding of cardiovascular health and the role of norepinephrine and epinephrine continues to evolve, ongoing research aims to further optimize their use and explore potential advancements in treatment options. One area of interest is the development of targeted therapies that selectively modulate the actions of norepinephrine and epinephrine. By specifically targeting receptors involved in blood pressure regulation and heart function, researchers hope to minimize side effects and improve treatment outcomes. Additionally, advancements in drug delivery systems, such as sustained-release formulations or alternative administration routes, may enhance the efficacy and convenience of norepinephrine and epinephrine therapies. These developments could potentially improve patient compliance and overall cardiovascular health outcomes. Furthermore, ongoing research aims to explore the potential of combining norepinephrine and epinephrine with other medications or interventions to enhance their therapeutic effects. By understanding the synergistic effects of these hormones with other treatment modalities, healthcare professionals may be able to optimize treatment strategies and improve patient outcomes. While future developments hold promise, it is important to continue conducting rigorous research and clinical trials to ensure the safety and efficacy of any new treatment approaches involving norepinephrine and epinephrine. Conclusion. In summary, norepinephrine and epinephrine play significant roles in cardiovascular health. Norepinephrine primarily regulates blood pressure and heart rate, while epinephrine is involved in the fight or flight response and has vasodilatory effects. Understanding the similarities and differences between these hormones is crucial in managing cardiovascular conditions effectively. Healthcare professionals utilize norepinephrine and epinephrine in various applications, such as stabilizing blood pressure, managing cardiac arrest, and treating anaphylaxis. While these hormones are invaluable tools, it is important to be aware of their potential side effects and precautions. Close monitoring of patients and individualized treatment decisions are necessary to ensure optimal cardiovascular health outcomes. As research and advancements continue, the future holds promise for further optimizing the use of norepinephrine and epinephrine in cardiovascular health. By exploring targeted therapies, improved drug delivery systems, and potential synergistic effects with other treatments, healthcare professionals can continue to enhance patient care and outcomes in the field of cardiovascular health.